location and the training time and have reconfirmed with the client 1 hour before they have arrived. I have checked with other personal trainers and group exercise instructors and made sure that the equipment I intend to use is not being required by someone else at this time. I have made sure that all the equipment I intend to use is set out in a particular order to make sure the session runs effectively and efficiently for the client. I have checked that all the equipment that is required for the session for any faults and possible hazards for my client, all the equipment is safe to use and doesn't require any changes to be made. I have checked all the training area to have not had any potential hazards for my client. The area is safe to train. Hello, Tony.
I'm good.
Do you know what's happening with this session today?
You're training?
We're going to go over fitness appraisal. We're going to do the measurements, body fat percentage, flexibility tests to determine what your goals are in the next 3 months, 6 months to a year. We're going to look at some strength exercises that you can incorporate into your program, some cardio training, and we'll also be doing some stretches at the end. Now I see that you've filled out this pre-fitness assessment. Do you have any medical conditions that will stop you from training?
No, nothing.
What are your goals that you hope to achieve in the next 1 to 3 months?
Increase my fitness level, burn some fat.
Yep. How about in the next 3 to 6 months?
Probably try and increase a little bit of size, build some more muscle.
And what do you hope to achieve in the next year?
Just beach bod.
Yep. Okay, that's cool. What we'll do now is we'll look at your measurements. So this will be a great starting point to see where you improve the next 3, 6 and 12 months. Some of the exercises that we performed today would be modified if there was high blood pressure, lower back pain, shoulder injury, or any special population people. For lower back pain can be caused by a variety of problems with any parts of the complex interconnected network of the spinal cord, spinal muscles, nerves, bones, discs and tendons in the lumbar spine. Typical sources of lower back pain can include the large nerve roots in the lower back that go down towards the legs may be irritated. Smaller nerves that supply the lower back may be irritated. The large paired lower back muscles may be strained. Bones and ligaments or joints might become damaged. And some of the exercises for the lower back pain can be improved by strengthening the back, the stomach and the leg muscles. They help support your spine, relieving the back pain. If someone does have lower back pain, I'll always refer them to a doctor to get medical clearance just in case they can't perform these activities, and also for my duty of care as well. Modifications to the chest press and to the upright row and the weighted lunge could be used on the TRX, which is the pulley system. Also, instead of going on the treadmill, which the stepping could impact the lower back, I would suggest that the client would use the cross trainer, where it uses similar muscles, but it just takes the impact off the lower back. With high blood pressure, there are different kinds of activities that have different effects on the body. Weightlifting would increase the blood pressure, so weightlifting I would not recommend for someone who has a high blood pressure of over 139. The activities that are best for lowering blood pressure that would still give them their fitness goals would be aerobic activities that helps the heart the most. Common shoulder injury, many shoulder problems are caused by the breakdown of the soft tissue in the shoulder region. Using the shoulder too much can cause the soft tissue to break down faster as people get older. The most common shoulder problems are dislocation, separation, radial cuff disease, radial cuff tear, frozen shoulder, fracture and arthritis. If a shoulder injury does occur, it's best to rest that area for a while. If the client does decide to ignore the warning signs or information that I give them, if they ignore that and they continue to work out on that area, it will do irreparable damage to their shoulder. Strengthening the muscles to support the shoulder will keep the shoulder joint stable. Keeping these muscles strong can relieve shoulder pain and prevent further injury. Stretching the muscles that you strengthen is the most important to restore range of motion and prevents injury. In general, stretching after strengthening exercises can reduce muscle soreness and keep your muscles long and flexible. Some shoulder conditioning exercises I have given to my client in case they do come across any shoulder injuries in the future. For part of your cardio assessment today, we're going to do the bike. To make sure you're training the appropriate intensity of the bike, I have calculated your heart rate, and I would like to get your heart rate in this session to around 130 to 140. So to set up the bike to suit you, to start with, make sure that the seat is in line with your hip. When you sit on the bike, make sure that when you stand that your knee isn't completely locked out, it's just a little bit bent. When you bend the leg, that your knee and your toe are in a straight line. It's not over here, it's not back here. When you start to pedal, make sure that your weight is back and not forward, and that your knees aren't locking out or overbending when you are turning the wheel. Is there any questions you'd like to ask before we start?
No.
Okay. Alright, so what we're going to do today is we're going to warm up at a slow pace. Then we're going to sprint for 30 seconds as fast as you can. Back it off and relax. Slow pedal for 10 seconds, and then hard again for 30 seconds, and slow back off for 10 seconds. We're going to do that 3 times. Okay. So please stand next to your bike and make sure that the seat is the right height. Yes, perfect. Just make sure that your laces are tucked in so it doesn't get caught in the pedals, and the foot cages are tight around your feet so they don't slip out. Make sure that your toes are all the way to the front. Your toes to be at the edge of the cage, because if it's not all the way in and you start to pedal quickly, it's going to jump out. Please make sure that your foot is correct. All the way in, so it's touching the end. You might notice that it's touching the end. Okay, is it tight enough? It's fine. Okay. Let me get my tire ready. Please just pedal to warm up. And I'm going to stop like this. Okay, so we're just going to lightly pedal. Okay, lightly pedal for 10 seconds.
To increase my resistance.
Yes, can you please put it around about, out of a 10, put it at about 7 out of 10 resistance on the bike. When we start to, I guess, come at a clockwise direction, when we start to increase the speed, I want you to breathe in through your nose, out through your mouth. Make sure that your back is straight, your arms aren't locked out, they're a little bit bent. We're not rising or falling today in the seat, we're just going to stay in the seat. 10 more seconds and we're going to go quickly for 30 seconds. How do you feel?
I think I'm going to be one out.
Okay. And go as hard as you can. This is to increase your heart rate. It's also meant to increase over time your VO2 max. This will help increase your cardio level, strengthen your legs, and over time will help you with your goals over the next few months. 5 more seconds and then we back off. Okay, back off for 10 seconds. Breathe in, out, slowly breathing down. Try and decrease the heart rate. Okay, go fast. We're going to go fast for 20 seconds now. I've changed my mind. Okay. We've got 5 seconds to go. You're going really well. 3, 2, 1. Back off. So, breathe in, breathe out, relax. 5 more seconds. 3, 2, 1, and then as fast as we can. This is the last one. You're going really well. Remember to hold the core strong, suck the belly in, chest up so you're not rounding the shoulders. And stop. Perfect. We will increase that over the length of your program, but in the case of this assessment, it's only meant to be short. Okay, we are now doing the cardio component of the assessment. Layton has already been assessed on his fitness level before. So in the treadmill, we are setting the treadmill at the speed of 11. We're doing it for 2 minutes to see how his heart rate goes. As I have explained to him, his heart rate will increase. The faster he goes, his blood pressure will increase. The faster he goes, and the calories he burns. Oxygen demands will be more the faster he goes, and over time he will fatigue. So away we go. Okay, so Layton, you're going to be starting off at 11 kilometres an hour on the treadmill for 2 minutes. I want your heart rate to be around 130 to 140 as before. We're starting off as you normally would run, and after 2 minutes we'll do the interval training on the treadmill. Oh, we'll stop after 2 minutes. So as you know, on the treadmill, when you're running, it works your quads, your hamstrings, your gluteus maximus. Satan is already fit. He was running in his spare time, so he's pretty fit. His running technique is perfect. His core is switched on. His feet are running in a straight line. He's not running in, his knees are over his toes, he's relaxed, he's running at a good pace, he's relaxed up top. How is your breathing?
Fine.
So Leighton, you're running fantastic. It's quite noisy in here to record, so I'm very sorry. How's your breathing?
Fine.
Okay. Alright, we have 20 more. Slightly elevated. Okay, so we're going to pause it now. That was a warm-up. Now we're going to do the interval training. This will over time increase your VO2 max, your cardiovascular system, your strength in your legs, which means that in the next couple of months it will develop muscles in your legs, be able to get you to run further, your endurance levels will increase, your blood pressure will improve, your resting heart rate will improve, your fat will go down, which is one of your goals. So what we're going to do is we're going to run at 18 for a minute, and then you're going to walk at a pace of 6 for a minute, run for 16, walk for 6, and that will complete the session, and then we'll stretch. Only because this is an assessment and it can't go for longer than 10 minutes, including the other one. Okay, so after that run that we just did, your heart rate is 97. Well done. Yeah, it's interval training. If you can't do them, actually, we'll just do 18 for 30 seconds. Okay, breathe in through the nose and out through the mouth. Let me know if it's too much and we'll slow it down. 20 seconds to go, and then we'll drop it down to 6. How are you feeling? Fine? Okay, bring it down to 6. Okay, now we're walking at the speed of 6 for 30 seconds. This is the interval training part. How are you feeling?
I'm fine.
Okay, so breathing in through the nose, out through the mouth. This is where you have to try and bring your heart rate down. over time, the more fit you get, the quicker your heart rate will come down when you're resting. Okay, back up to, we'll do 16.
168.
Okay. Okay. 16 kilometers an hour for 30 seconds. Perfect technique for running, his back is straight. Correct technique is great. We are now moving it back down to 6 kilometers an hour. Like at the beginning of the assessment, Leighton doesn't have any medical conditions. He feels no pain when exercising, so running for him at this speed is okay. How are you feeling? Okay. For the purpose of this assessment, that will be the end of the interval training section, as it needs to be under 5 minutes. We will now be going on to the stretching and the end of the assessment. Because we did a full body workout today using most of the major muscle groups, we'll be doing a full body stretch. So the first stretch I'm going to be showing Leighton will be a quad stretch. It depends on your core strength and how stable you are. You can do the quad stretch without holding onto anything. Lifting the leg, make sure the heel is touching the bum. The knee that is bent is next to the knee that is straight. This will be stretching all the quads here. You can use it with no support, or you can use a wall, chair, or whatever you have for support. That will be used on both legs. Be holding the stretch for 10 seconds. We don't want to overstretch it, which can lead to injury. The next stretch we'll be doing for the legs will be a hamstring stretch. This one is where your feet are in line with your shoulders, your knees are slightly bent. You don't want to be locked out, that will cause injury. Using a straight back and your fingers guiding towards your toes. You're going to bend over, see how far you can go. Your weight is to be back, and we'll hold that stretch for 10 seconds. The next exercise will be stretching the shoulder muscles. So we're going to cross it over the body. We're going to use the left hand or the right hand, depending on what side the other arm is crossing. Pull it towards the body. We're going to stretch the chest muscles, which was used in the bench press. We're going to interlock the fingers at the back. We're going to roll our shoulders back and down. Lift up our hands a little bit. Arms aren't completely straight, there is a slight bend. We're going to press our chest forward. This will give you a nice stretch at the front of your chest. Okay, Leighton, please show me how to stretch the quads. So, yes, bring your bent knee in closer to the other supporting knee, If you can't feel the stretch, you can push your hip a little bit forward. How is that?
That's good.
Okay, and the other leg. Perfect technique. Core held tight. Hips aren't twisted, they're straight. Can you feel that in your quad?
Yeah.
Okay. And relax. Now we're going to do the overbody cross arm, which will stretch your shoulders. So please put your, that arm, that's correct. Yep. Can you feel that?
Yeah.
Okay. His arm's not straight, it's slightly bent. Toes are facing forward, hips are facing forward. And change arms. Perfect. How does that feel?
Good.
I'm just asking. Okay, and relax. Now we're going to stretch your chest, so please interlock your fingers at the back. Straighten your arms but not too straight. Push your chest forward, hips forward, feet forward. Can you feel it in your chest?
Yeah.
Okay, great. 5, 4, 3, 2, 1. Breathe in, breathe out. Yep. And the hamstring stretch, which is what I forgot to say. His legs aren't completely locked, they're slightly bent, his weight is back. Leighton is quite flexible as he already does karate. Can you feel that in your legs?
Yeah.
Okay. And breathe in, breathe out, and release.